Hi and Assalamualaikum. My name is Salma Fahima binti Abdul Aziz and this is my matric number 8204805. In this video, I'm going to talk about my pre-departure preparation for my clinical for AKRT1. Okay, let's go. So, first thing first, for my personal preparation, I will make sure that I have my full vaccination for hepatitis B to make sure that I am ready and my immune system is enough considering that I'll be working at the hospital.
Not only that, I will also prepare myself regarding radiation protection safety, which include understanding radiation risk and also protective measure. Next, I will make sure that my unnecessary jewelry taken off to ensure infection control and for personal safety.
Now let's talk about my attire. I will make sure that I follow the required dress code such as smart casual with a lab coat and all black full covered shoes, and not to forget my lanyard and OSL to monitor radiation exposure toward us. Since I'm living in rented house, I will arrange my accommodation and transportation. During our clinical attachment briefing, Dr. Safan also told us regarding the shuttle bus that will be provided, which I will take from the KTSN or the faculty to Hctm, and it usually depart an hour early. But if the bus is not provided, I'll be using affordable e-hailing options like Grab or Maxim with my friends to get to the hospital. And the last option is that I will take MRT and shuttle bus to the hospital, and I'll check the traffic 2 hours early to make sure we arrive on time. And now let's check out the overview of the oncology department at Hctm.
This is the organization chart of the Oncology and Radiotherapy Department in Hctm. As you can tell, Dr. Marfuani Ezamuddin is the head of Ward Oncology, and then our Oncology Supervisor, which is Puan Ainun Zubaidah Muhammad, and our Chief Nurse is Puan Nurhayati Mustafa.
During the clinical attachment briefing, we were informed that our first placement will be in the oncology ward with a primary focus on vital signs. Vital signs are essential indicators of a person's health and are typically measured during medical assessment, and they include body temperature, which is they use thermometers such as oral, tympanic, or axillary. It reflects the body's ability to regulate heat. And then the normal ranges are around 36.2 degrees Celsius to 37.5 degrees Celsius. So next is for the pulse or heart rate. So it indicates the number of heart beats per minute. Normal resting heart rate for adults is between 60 to 100 beats per minute. Next is for the respiratory rate. The number of breaths a person takes per minute is the normal rate, which is around 12 to 20 breaths per minute. So next is for the blood pressure. We usually use automatic or manual sphygmomanometer, which measures the force of blood against the arterial walls. A normal reading is around 120 per 80 mmHg. If it goes above the 120, it's considered abnormality. So next is for the oxygen saturation or SpO2. It represents the number of oxygen in the blood, which is the normal range around 95% to 100%. And lastly is the ECG, which is electrocardiogram. This modality helps to monitor the cardiac health to provide detailed picture of the heart function. Now, let's talk about practical information that I have gathered from my seniors. So, during our attachment, we will be monitoring the vital signs of the patient such as BP, ECG, pulse rate, temperature, and more. We also will learn and practice the good patient care such as patient communication to gain and nurture empathy towards the patient. We will be assigned to observe the patient condition such as the vital signs to look for any general signs of distress and to ensure their condition is normal condition. For the ethical consideration, as a student who is assigned to be a part of the department team, I will ensure the patient autonomy, which is always ask for the consent before performing any procedures and respect patient choices. Next, for the confidentiality, which is I will be keeping all the patient information private and only share it with the authorized staff. And next is do good, which is I will act in the patient's best interest by providing accurate care and ensuring their comfort. And I will treat all patients fairly and equally regardless of their background or condition, and show empathy and respect their dignity to provide emotional support.
I hope I'll be having so much fun during attachment. Bye!